السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Barometric Test Question. This is lecture number 1 in medication and number 18 in Ghaith review. Today we are going to discuss 5 questions from question number 106 up to question number 110. معكم محمد اسماعيل. نبدأ مباشرة. Question number 106. Select the most common type of medication that may be ordered by a physician to treat nephrotic syndrome. The options are number A, cardiac glucoside, number B, corticosteroids, number C, antihypertensive, number D, anticholinergics. وقف الفيديو هنا واختار الخيار اللي بتشوفه صحيح. The correct option is option number B, corticosteroid. ليه اخترنا الخيار رقم B؟ نشوف rational. Corticosteroids are commonly ordered for treatment of nephrotic syndrome. These medications will help reduce swelling and decrease the amount of protein lost in the urine. So the correct option is option number B, corticosteroid. Other medications such as diuretics will help remove extra fluid in the body, and immunosuppressive also, which will further suppress the immune system. Question number 107. When assessing for adverse reactions to isoniazid, the nurse will monitor which laboratory values. The options are number A, liver enzyme levels, number B, hematocrit and hemoglobin levels, number C, creatinine level, number D, platelet count. وقف الفيديو هنا واختار الخيار بشو صحيح. The correct option is option number A, liver enzyme levels. اللي اخترنا الخيار رقم A نشوف rational. Isoniazid is the most common used medication for tuberculosis. Isoniazid is well-known cause of acute clinical liver injury, which can be severe and is sometimes fatal. So the nurse should monitor liver enzyme levels, which is the correct option. Other side effects of isoniazid are numbness, drowsiness, tremors, rash, blurred vision, photosensitivity, tinnitus, dizziness, GI distress such as nausea, vomiting, dry mouth, and constipation. Question number 108. A 66-year-old woman with a history of unstable angina and hypertension present to the emergency department with a dull chest pain that she described as similar to heartburn. The pain radiates down the left arm. She had taken sublingual nitroglycerin tablets. Electrocardiograph is performed and shows elevated ST segment. Which medication is most likely to given to dissolve the thrombus? The options are number A, heparin, number B, warfarin, number C, streptokinase, number D, aspirin. وقف الفيديو هنا واختار الخيار بالشو صحيح. The correct option is option number C, streptokinase. اللي اخترنا الخيار رقم C نشوف rational. Streptokinase belongs to a class of drugs called thrombolytic agent. It is used to break down clots in some cases of myocardial infarction, pulmonary embolism, and arterial thromboembolism. So the correct option is option number C, which is streptokinase. Option number A and B, heparin and warfarin, are incorrect because heparin and warfarin are anticoagulants used to help prevent clot formation. Option number D also incorrect because aspirin is non-steroidal anti-inflammatory drug. It is also inhibit platelet aggregation and is used in the prevention of blood clots. Question number 109. A 62-year-old man with a history of intracerebral bleeding 3 months ago was referred primary health care following acute stroke symptoms. Brain CT scan is normal and the patient is receiving oxygen by nasal cannula at 4 liters per minute. Blood pressure 185 over 105, heart rate 82, respiratory rate 18, temperature 36.6, SO2 93%. Which of the following medication will be ordered first? The options are number A, RTPA, number B, aspirin, number C, dopamine, number D, نيكاردبين. وقف الفيديو هنا واختار الخيار بالشيء الصحيح. The correct option is option number B, aspirin. ليه اخترنا الخيار رقم B؟ نشوف rational. First eliminate option number C, dopamines. Why? Because dopamine is contraindicated for patients suffering from blockage or closing off of blood vessel and decreased oxygen in the tissue or blood. Option number A, RTPA. RTPA is an acronym of recombinant tissue plasminogen activator. It is fibrinolytic therapy, also known as thrombolytic therapy. It is contraindicated for patients with significant head trauma or prior stroke in the previous 3 months. So the patient is not eligible for treatment with this medication because the patient has prior stroke in the previous 3 months. Therefore, we should eliminate option number A also, RTPA. If patient is eligible for treatment with RTPA and systolic blood pressure greater than 185 or diastolic blood pressure greater than 110, start treatment to decrease blood pressure with either labetalol IV or nicardipine infusion. Since the patient is ineligible for treatment with RTPA and the patient's blood pressure is less than 185 over 110, so the option number D also should be eliminated, nicardipine, which is calcium channel blockers. So the correct option is option number B, which is aspirin. Question number 110. A nurse checks the medication chart of a patient which has the following order: nitroglycerin, tab, sublingual. Which of the following medication administration routes should the nurse use? The options are number A, in the nose, number B, in the eyelids, number C, under the skin, number D, under the tongue. وقف الفيديو هنا واختار الخيار الشيء الصحيح. The correct option is option number D, under the patient tongues. ليه اخترنا الخيار رقم D؟ نشوف rational. Nitroglycerin sublingual tablets are used to treat episodes of angina, chest pain, in people who have coronary artery disease. It is also used just before activities that may cause episode of angina in order to prevent the angina from occurring. Nitroglycerin come as sublingual tablet to take under the tongue. So the correct option is option number D. شكرا جزيلا، نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.